Today's press briefing, we have on the stage two doctors, Dr. Albert Au, Principal Medical and Health Officer, Communicable Disease Branch of Center for Health Protection, and Dr. Lau Kai-hin, Chief Manager of Hospital Authority. The two doctors will give us a report on COVID update and also Hospital Authority situation. Dr. Au, Hong Kong citizens, friends from the media, good afternoon. I'd like to report COVID-19 situation as of yesterday, the 26th of June. We recorded 1,719 local cases, including 609 PCR positive cases, as well as 1,110 positive RAT results confirmed via PCR. As of yesterday, we also recorded 154 imported cases, including 121 PCR positive cases and 33 RAT positive cases. Cumulatively, since the start of the fifth wave, we have recorded 1.22719 cases, a million cases, and we did not record any death case yesterday. So far, the death count remains at 9,185 in the fifth wave. Dr. Lau will give an update on HA situation. We have 625 patients in HA facilities, with 77 cases being new cases. For those requiring isolation facilities, 190 are in isolation wards, 22 are in second-tier wards, and 185 patients are now receiving treatment in the North End Town Hospital, Hong Kong Infection Control Center, and 55 of them are new cases. We did not record new cases in critical condition yesterday, and we recorded 3 cases in serious condition. For inpatients, there are 11 now in critical condition and 15 in serious condition. 3 critical patients are now receiving intensive care at the moment, and as mentioned by Dr. Au, as of yesterday, we have not recorded any new death cases. As we all know, for recently infected cases, they exhibit milder symptoms. Although the hospital admission rate has gone up slightly comparing to the rate a few weeks ago, the number of patients in critical or serious conditions at the moment has not registered a drastic increase. So far, we believe the situation remains stable. I'll give the floor to Dr. Au. I'll continue to report on the cases received yesterday. Of the 154 imported cases, 70 were picked up at the TP's Temporary Specimen Collection Center at the airport, and 58 cases were picked up in quarantine hotels. And for the remaining 26 cases, they were picked up at the end of the quarantine period, and we will conduct gene sequencing analysis to see if these are imported or local cases. We believe the majority of them are repositive cases as they carry high CT values. As for residential care homes yesterday, we recorded the 3 homes with new cases. The first one is Sai Gong Tong Sin Han elderly home. One worker there tested positive. On the 25th of June, the worker started to exhibit symptoms, and on the same day, the RAT result became positive. The worker received 3 jabs, and the worker last worked on the 25th of June. Whilst on duty, this worker would have a quite close bodily contact with elderly residents, and 9 residents are now regarded as close contacts to be sent to quarantine. The second is Wang Tai Sin Jiwen Samgan Wu Lou Yun. In this home, 1 care worker also tested positive, who received 3 jabs. The worker works on the 2nd floor, and whilst on duty, he's on full PPE. He tested positive on the 24th of June, which is also the day that he last worked. 7 no residents were regarded as close contacts. For Chongling Yun in Yuen Long last week, we also reported on some cases happening on the 3rd floor. 2 residents tested positive, and other residents in the same ward have been sent to quarantine as close contacts. And yesterday, this home also reported 2 more cases of, involving residents and 2 cases involving staff members, and they received 2 jabs respectively. One is a care worker who tested positive on the 25th. The worker last attended work on the 24th. The other worker was a food delivery. The worker tested positive on the 26th via RAT, and the worker last worked on the 25th. And on the same floor, there are altogether 5 residents testing positive, residing in 4 different rooms. They have all received 3 jabs, and the majority of them exhibit only mild symptoms or no symptom at all. On the same floor, there are 9 other residents listed as close contacts to be sent to quarantine, and 9 staff members are also listed as close contacts. As for schools, yesterday, as of today, we received reports from 464 cases involving 335 schools, including 66 kindergartens, 153 primary schools, 110 secondary schools, and 6 special schools. We recorded 154 schools, which recorded more than 2 cases in the past 7 days. For the cases reported this morning, 110 reported positive this morning. As for the remaining specimens, most of them were collected between the 24th and 26th of June. Upon our investigation, we found that for some classes in 7 schools, there could be some outbreaks, and we've advised the relevant classes to suspend teaching for the time being. The first one is Evacuation in East Kowloon, class 4A altogether. Cumulatively, 6 students are now found positive. This class has 27 students. We have advised this class to suspend for the time being. The second school is Alumni Association of Robert Black College, 盧邦紀念學校 in Kwai Chung. Class 4B has 20 students, and 3 students have tested positive so far. So this class will be suspended. The third one, ABC Halfways International Kindergartens in Whampoa, K2B. In this class, 1 student and 1 teacher have tested positive. There are altogether 16 students in the class, and again, we have recommended suspension. The fourth one, 中華基督教元朗堂真光幼稚園 number 2, and for the morning class of K2, in K3, 4 students tested positive. In the afternoon class, 3 students tested positive, and 1 teacher of the class also tested positive. We have recommended K3, the morning and the afternoon sessions, to suspend teaching for the time being. The 5th one, 培正中學, class 2F, with 30 students. So far, 3 students have tested positive. The 6th school, 香海正覺蓮社佛教惠光 Kindergarten. For class K1B, there are 15 students, and 2 teachers of the class have tested positive, and we have recommended suspension. The final 聖公會慈光聖象堂幼稚園. And then in the afternoon class, there are 12 students, and that 2 students have tested positive. We have also recommended class suspension.
In terms of genome sequencing, yesterday, the Public Health Laboratory found 15 cases of suspected cases with the BA.2.12.1 strains and related cases. For 3 of the cases, they were untraceable, and 2 cases were epidemiologically linked with these 3 untraceable cases. 1 lived in Kinmen House Oilman Estate, another lived in Lam Tay Castle Peak Road, another lived in second block of Hoi To Wan, another lived in Heng Tai House of Tai Heng Estate, and the patient lived in the same building as a prior case, and the case was found through compulsory testing of the building. Another lived in Ying'an House, Shanking Estate, and the patient lived in the same building of an earlier case. Again, the case was found through compulsory testing. The three other cases related to Victoria Harbour Restaurant were all diners to the restaurant. And on the 16th of June, 41 patrons visited the restaurant. No staff members were involved in. There were a total of 24 males and 17 females aged 6 to 75 years old. And they started experiencing symptoms from the 17th to 24th of June, and the EMSD completed examination of the ventilation systems of the restaurant, and they made an inspection. It was found that the fresh air ventilation rate and rate of air exchange were lower than normal, and that possibly led to the outbreak. And the 5 suspected cases of BA.2.12.1 had to do with the Futai elderly home, and it was confirmed that these cases carry the BA.2.12.1 strain, and 12 residents and 5 staff members were affected. As we announced yesterday, one of the cases was a re-positive case, and for one of the cases carrying the BA.2.12.1 strain, it was potentially a re-positive, and on the 25th, the patient tested positive towards RAT, and antiviral drugs were administered, and on the 24th of June, the PCR test came back positive. CT was 14.5. It was a new infection with BA.2.12.1. Finally, the other subvariants of Omicron. Yesterday, there were 9 cases of suspected cases with BA.4 or .5. 6 were imported, 3 were local cases. Of the local cases, 2 were untraceable, including 1 patient who lived in Laguna Verde. It was a 6-year-old girl who was unvaccinated. She studied in K3 in Good Hope School, and onset of symptoms started on the 21st, and she last went to school on the 22nd. And on the 19th of June, she visited Long Kok, a restaurant at Whampoa Garden, and her father also tested positive. It was a 37-year-old male who worked at AIA Center, and he started showing symptoms on the 24th, and he tested positive through RAT on the same day. On the 23rd of June, he and his friends visited the bistro restaurant in Sampo Kong, and those who dined at the same restaurant were listed as close contacts, and his family members did not show any symptoms. Another untraceable case involved a 14-year-old girl who lived in Grand Hyatt Hotel, and she was a Century 3 student, and onset of symptoms started on the 22nd, and RAT result came back positive on the 23rd. Over the past day, we had 52 patients who recovered, including 44 who were discharged. Since the 5th wave started, 51,700 patients recovered, including 51,354 patients who have been discharged since early 2020. 64,080 patients, COVID patients recovered, including 63,734 who have been discharged. 1 patient came back positive through the admission screening, and 1 patient in the same ward was classified as a close contact. 24,193 staff members tested positive so far. of which 23,934 have returned to their posts. Meanwhile, we have an update on the cluster from the Clinical Oncology Ward of Prince of Wales Hospital. Today, another patient who was discharged tested positive. The patient is on home quarantine and he's in stable condition. So far, 5 patients and 4 staff members from the cluster tested positive. The hospital will continue to follow up with the CHP on the latest situation. That's all from us. The floor is now open for questions. Please identify your organization before you speak. The gentleman, please. Good afternoon. This is Ming Pao. I have 3 questions. First, on the situation at Fu Tai Elderly Home. As of now, were all residents from that elderly home quarantined? How many people were sent to quarantine? And how many returned to the elderly home after testing negative at the quarantine facility? What were the criteria used to decide when the residents can return to the elderly home? Yesterday, you said that residents stayed on the 2nd and 3rd floors. Does it mean there were only cases from residents staying on the 2nd and 3rd floors? In terms of the 2nd generation vaccines for Omicron, did DH receive any applications from pharmaceutical companies on the use of such vaccine in Hong Kong? If so, from which companies did you receive the applications and what is the progress of the applications? We learned today that there were new cases at other elderly homes. If we continue to see new cases from elderly homes, what would be the arrangements at the quarantine facilities? And if the facilities are inadequate, where could these people go? Thank you for your questions. First, you asked about the situation at Fu Tai Elderly Home. We have not seen new cases so far. So far, 10 residents and 5 staff members tested positive. Most residents who tested positive stayed on the 2nd and 3rd floors. Initially, the residents were staying in the 2nd floor, and 42 residents from that floor were all evacuated and sent to a quarantine center. And later, we saw cases from the 4th floor, and subsequently, all residents from the 4th floor were sent to a quarantine center. There were about 55 so far. About 100 residents from that elderly home had to be quarantined. As for staff members, at least 2 were not in direct contact with residents. They carried out clerical duties, and some staff members of the elderly home had to take care of the residents, and we will continue to monitor the situation. The quarantine arrangements for residents from elderly homes is same as other members of the public. The day they test positive is considered day 0, and they have to undergo a 14-day quarantine. But if they have received 2 doses of a vaccine by day 6 and 7, if the test results were negative, they would be seen as completing the quarantine and they could return to their homes. And this is the same arrangement at Asia World Expo.
Your next question relates to 2nd generation vaccine, and under the government's mechanism, according to CAP 599K, the Secretary for Food and Health can consider applications from the suppliers, manufacturers of vaccines, and having regard to the scientific committee's opinion, make approval to these applications for COVID-19 vaccines to be administered for specific purposes. The scientific committee under the CHP and also the expert advisors to the chief executive will on a regular basis review the latest scientific evidence. So far, the government has not received any application for registration of the second generation vaccines. Next question about quarantine facilities. The Social Welfare Department commissioned 2 new sports centers as holding centers for the elderly since Saturday. So for residential care homes for the elderly and the disabled, should new cases emerge, if they exhibit no symptoms or mild symptoms, they will be sent to these holding centers for quarantine of isolation. As for the existing facilities previously used as isolation facilities in Asia World Expo, they've now been switched to quarantine facilities instead, and the uninfected residents will be sent to quarantine in AWE, and the close contacts likewise will be arranged to undergo quarantine in a quarantine facilities or observe home quarantine. Next question. I'm from TVB. A question on Victoria Harbour Restaurant. The EMSD inspected the restaurant and found that the air exchange rate and the fresh air rate are below standard. Will you check other restaurants of the same chain to see if a similar problem occurs to prevent further outbreaks? And about the source of infection in the Victoria Harbour restaurant cluster, has it to do with the elderly home? Another question for government officials who will be attending the July 1st celebrations, they will now be quarantined in a hotel starting today. Will this minimize the risk of transmission? And what will happen if one of the officials tests positive? About the outbreak at Victoria Harbour Restaurant, according to the EMSD's inspection, we consider first of all the amount of fresh air and the air exchange rate of the restaurant. Both are substandard. For air exchange rates per hour, according to the regulation under CAP 599, the per hour rate should reach 6 times per hour with ventilators installed, and according to EMSD in different areas of the restaurant, the readings were 1.37 to 2.12, so that's below standard. As for the amount of fresh air, there should be 4 times, more than 4 times per hour, depending on the number of persons involved. And again, the reading taken that day was just 1.3 or so. So that shows that improvement is needed, and we have contacted the FEHT, and they've urged the restaurant to improve the air quality situation, and only approval will be given after EMSD's inspection. As for other restaurants, so far we have not identified any clusters or outbreaks, and in normal circumstances in Hong Kong, all restaurants are required to observe the directions given by the FEHT under CAP 599 and also CAP 132, and that both parameters should be met. And I believe that the relevant law enforcement agencies and the FEHT will continue to conduct regular inspections. The second question relates to July 1st celebrations. I believe that the government has laid down a set of anti-epidemic measures and infection control measures. I have nothing further to comment. Next question. From now, first question about July 1st. We have continued to see the daily infection cases reaching 1,000 or close to 2,000. What is your view on major celebration events or large-scale events? What is your assessment of transmission? Is it possible that the 6th wave will hit us after the celebration? Why is it that despite the current situation, the current social distancing measures will remain until the middle of July? And about the Victoria Harbour Restaurant, it said that the fresh air volume is not up to standard, and there hasn't been another outbreak apart from this restaurant. Have you checked other similar restaurants? And will the restaurant be responsible for the issue? And next question about quarantine for home residents. Since the start of the fifth wave, ventilation in these homes have not improved. And has the government followed up on the issue? In case of the sixth wave hitting us, will there be room for improvement? First question about the daily figures. Recently, the daily caseload has remained at about 1,500 to 1,800, and in terms of the trend, it's a slowly increasing trend, and it's now close to 2,000 cases a day. We expect the current level to remain for some time or even edge up a little bit further. This is only within our expectation as we are returning to normalcy with the social distancing measures being gradually relaxed. We'll continue to keep in view the current situation and see whether the current caseload would in any way pose a burden on the public healthcare system. Now, as far as the current situation goes, this is not happening yet. And indeed, despite the increase in number of cases, the number of hospital admissions or severe cases or death cases have remained stable, but we'll keep in view the situation. Second question about Victoria Harbour Restaurant in Chelsea Heights. Indeed, there is an outbreak, and upon our investigation, we have identified a problem with the ventilation system. As for other branches of the same same restaurants, we have not identified other problems since they are located elsewhere, and we have not identified any other major outbreak or cluster. But we'll continue to monitor the situation and see whether similar outbreaks will occur at other places. Now, in fact, all restaurants are required to comply with the legal requirements of the FEHD under the law to make sure that the fresh air volume and the air exchange rate will meet the required standards. And in fact, earlier, the CHP and the Social Welfare Department conducted inspections on residential care homes to check their ventilation systems, and that the residential care homes have continued to liaise with the SWD, and in case of any irregularity, the SWD will follow up on the cases.
Next question, please. The lady in white, please. This is cable TV. I have some questions about the anniversary celebrations. We are going to have a long holiday for July the 1st. Are we going to hit more than 2,000 cases per day? Since the epidemic control measures would remain, what is your assessment on the trend of the pandemic? And also about the Victoria Harbour restaurant cluster, we saw second generation infections involving Tai Hing Estate and Shanking Estate. So how far were the patients living from those floors or cases, and did they come into any contact? Like we said, the daily caseload is around 1,500 per day. Since social distancing measures have been relaxed, we assume that transmission chains were present in the community, and we expect the caseload to remain as a similar level, or it could also go up. The upward trend is currently under control, and we do not expect the number of cases to multiply within a number of days. So we see a gradual upward trend, and we will continue to keep tabs on the situation. Even though social distancing measures are gradually relaxed and normalcy has gradually been restored, the caseload could still go up gradually. So for people who are not vaccinated, please ensure that you do so as soon as possible in order to acquire protection that would minimize fatalities or serious complications. Apart from vaccination, please observe various social distancing measures despite recent relaxation. So when you go out or come into contact with other people, please remain prudent, observe personal hygiene, and keep your mask on. And please also do RAT tests. So in case you test positive, you can avoid spreading it to those around you. For Tai Hing Estate and Shanking Estate and the 2 cases involved, both cases were detected through compulsory testing at the respective buildings. So for cases involving the new subvariant BA.2.12.1, we would adopt a careful approach and list the relevant, include the relevant buildings under compulsory testing. For these 2 cases, they lived downstairs in the same building as the places of residence of previous cases. Since the 2 units were very close to each other, transmission might take place through the exhaust fans in the bathroom or the kitchen, or transmission could also take place through the water pipes. So in that case, we would issue compulsory testing notices for the relevant buildings. So in case of transmission of BA.2.12.1, we can identify any other cases swiftly. Next question, please. This is Hong Kong 01. I'd like to know more about the criteria under which residents from elderly homes would be evacuated. Yesterday, 42 elderly homes were transferred to the Asia World Expo, but since only 2 vehicles were deployed, evacuation took place till midnight. Would the government streamline the relevant transfer procedures for the elderly residents? 335 schools saw positive cases, which is a considerable number. Since 335 schools have seen positive cases, would daily RAT tests still be effective? In terms of the evacuation of elderly homes, for residents who are listed as close contacts, they must be sent to quarantine centers. It depends on whether an elderly home has seen an outbreak and whether staff members were involved. If the only ones infected were staff members, we would examine whether they had the appropriate equipment when coming into contact with residents. If there's proper equipment, residents might not be affected or infected. And for residents in the same environment or living in the next unit, they could be classified as close contacts. As for the scale of evacuation, it would depend on the actual circumstances. For some elderly homes, they saw outbreaks, for instance, the Futai elderly home. So basically, all residents from the same floor were prone to exposure, so they had to be evacuated. Normally, we would issue an isolation order as soon as possible, and the social welfare department would contact the elderly home concerned and transfer the elderly residents to AWE as soon as possible. The SWD set up a hotline so that for elderly homes who encounter difficulties, they can get in touch with the SWD as soon as possible. I believe the relevant departments are working with the HA and Fire Services Department so that those classified as close contacts could be sent to quarantine centers as soon as possible. As for the RAT testing requirement at schools, we have seen that RATs were a very effective way in detecting or preventing any outbreaks from schools. We had more than 700,000 students and more than 100,000 staff members who reported RAT results every day. We saw small-scale outbreaks between or within certain classes of schools. We did not observe any large-scale outbreaks between classes or within a school. And the main reason was the students or people who tested positive would stop going to school immediately. That's why we did not see major outbreaks in school so far. Next question. This is AM 730. You talked about pushing middle school class 2F. Was it not related to the school athletics competition? What about the Yuen Long School? Can you tell us more about the sharing of facilities for the July 1st holiday, apart from the government celebrations? There could be a lot of activities among the public, and the LCSD open up some venues for free. Do you expect the number of cases to multiply, or do you not expect that to happen? For BA.4 or .5 suspected cases, you told us about certain locally acquired cases. Have you identified their sources yet? For BA.5, there could be silent transmission right now. For two of the imported cases earlier, the family members of patients were suspected to be infected already. Can you provide more information? For Puiching Middle School, Class 2F saw 3 new cases. We believe it had nothing to do with the outbreak of the sprinting team of the same school earlier, since these students were not part of the sprinting team. We would carry out genome sequencing on the samples. The earlier outbreak among the sprinting team involved BA.2.12.1. Your second question was about the Yuen Long Tong True Light Kindergarten. For the two classes had 31 and 30 students respectively. Four cases from the morning class and 3 cases from the afternoon class, and both classes share the same classroom. We expect transmission to have taken place at that classroom. So both classes who use that classroom had to be suspended.
Yeah.
Second question about the long weekend and whether there'll be a heightened risk of transmission. Now, with more social activities during the weekend, especially when people go to restaurants, there will be a higher risk of infection. However, when you go out, as long as you observe all the necessary measures, including the wearing of masks and being vigilant during in crowded places, and that if you're unwell, you should refrain from going out, you should be able to avoid a major outbreak. Now, after the long weekend, then with more activities, there may be an increase in the number of cases. We'll keep in view the situation, and we believe that overall speaking, there is quite a high level of immunity in the community. So we don't expect an exponential growth in the number of cases after the long weekend, only that there may be indeed an increase in the number of cases because of more social activities. We will continue to closely monitor the number of cases and the burden on public health care. On BA.4.5, we found 2 untraceable cases today, and upon preliminary epidemiological investigation, we haven't found any linkage with previous cases or any epidemiological link with other major clusters. So for these 2 untraceable cases, we believe that the BA.4 or .5 subvariant might have started a transmission chain in the community. So we'll closely keep in view the situation. We'll also conduct gene sequencing for these 3 cases to see if the sequencing matches other cases, or see if we can find any connection. The result will come out in a few days. For previous cases, we are able to identify connection with, say, imported cases or with other high-risk factors. For example, there is a case working at the airport, and there could be contact with an imported case. There is a case working at the airport, and there are also 2 other cases who are family members of a confirmed imported case testing positive in the 9th-day specimen. So we need to find out if there is linkage with the previous cases. Right, last question. I'm from Orange News. First on Victoria Harbour Restaurant, about the 2 cases living in Tai Hing Estate. Will they be the source of infection? And about Yuen Long Church, Chan Kwong, number 2 kindergarten, Yuen Long, what is the source of infection? Did the teacher have the onset first or students? And also Class 4A of United Christian College, 6 students have been infected. Do they sit close to each other in the classroom? Did they share any common facility? Did they take off their mask? What is the route of transmission? And also for the new BA.4.5 cases identified today, recently we have identified confirmed cases getting infected again. What is your assessment of this trend? About Victoria Harbour Restaurant, so far we have identified 41 confirmed cases, all being patrons. The earliest onset was the 17th of June. That's the case we have been able to identify so far. And they had dinner on the 16th of June, and so far we're not able to ascertain the source. There could be a super spreader at the restaurant causing the outbreak. It's been a while. So if the case is asymptomatic with high CT value, eventually we may not be able to find out about the source of infection. Next question about Chan Kwong, number 2 kindergarten. Is that the kindergarten? Right. The first case involves going on in K3 afternoon session. And then on the 23rd, the case tested positive, followed by the teacher who tested positive on the 24th. And today, 6 more cases have emerged, including 4 in the morning class and 2 in the afternoon class. It is possible that one of the students might have gone to school before testing positive, causing the transmission to occur in the classroom, and that there is a transmission going on in the classroom. The second school is United Christian College. Indeed, there are 6 cases. The earliest case tested positive was last Friday, and after testing positive, the student did not go to school. And today, we received 5 more reports in the same class, so altogether 6 cases. Now, we inquired with the students, and whilst in class, they all wore a mask, and they did not eat anything, and they also took the precautionary measures in class. But Omicron is, after all, highly transmissible, and perhaps a case which was highly transmissible caused the transmission. And according to WHO's information about recovered patients getting infected again, there are other sublineages, including BA.2.12.1, BA.4, and BA.5 of Omicron. There might be sort of an immunity escape or leakage, and this is not the same as the other variants of coronavirus, especially BA.4 and BA.5, and that it is possible that the recovered person could get infected again, especially after, say, a 90-day period, and sometime after infection, your immunity level will drop. So we have 3 subvariants of Omicron at the moment, and the vaccine remains effective. That's the end of today's press briefing.